Hi everyone. So today we'll talk about tantrums. So very commonly used terms कि बच्चा गुस्सा कर रहा है, he's very irritable, he's very aggressive, he doesn't listen to us, he just throws things off, he rolls on the ground. But what exactly are tantrums? Tantrums is a very mentalistic term or very layman term that we talk in, that he shows tantrums. Basically, it's a behavior which is not socially acceptable. It is not acceptable in the society in the way it is. So these are called as tantrums. Now, there is always a reason for the tantrum. We never try to find out the reason and why it is happening. So first we'll go for why it is happening. Tantrums or a problem behavior is basically a learned behavior. Whenever a child asks or cries for a chocolate and he gets a chocolate, it's a small tangible, it's a small thing which the child cries for. But he comes to know that crying is the way to get something. And then it increases, and that becomes a learned behavior. And he starts doing the same behavior for whatever and everything he wants. And then we say that it is tantrum. So basically it's a learned behavior which is usually reinforced, which has been reinforced in the past, and that's why it has become a learned behavior. Now to reduce the tantrums, or to say that how to reduce the problem behavior, first we need to know what is a problem behavior. So problem behavior can be of multiple types. It can be just shouting, screaming, whining, crying, going to a bigger extent, or a more severe one is harm to the property, harm to self, throwing things, getting destructive, hitting others, hitting himself, and going further is rolling on the ground, head banging, and stuff which can harm the child a lot. So these are the forms of tantrums. That is, the child shows the behavior in these all forms whenever something happens to the child which he doesn't want. So now we'll go for what are the causes of tantrums. So usually a child shows abnormal behavior or shows a problem behavior for some or the other reasons. We as a parent or as a therapist or as a doctor need to know that what are the causes of these tantrums. So first, it can be to ask for something or ask for a toy or request for a toy when the child is unable to communicate that I want this. So the easiest way for him is shout. Second thing is, if he doesn't want to do something, he wants to run away from a difficult task or escape from a difficult task. So what is the way? Okay, if I roll over or if I start crying, mama will not give me that task. So I get escape from that task. Or to avoid a task. For example, if I have to go to a doctor and I know that doctor gives me an injection, to avoid that, I will start crying or I'll start rolling on the ground, and that what mama does, okay, we'll go later. So that's a learned behavior, that if I cry or roll on the ground, mama will stop that or mama will give me that. One more important cause of tantrum is attention. So if the child wants attention from a parent, from a teacher, from a sibling, friend, he starts showing a behavior which will give them attention. These three are the major causes of tantrum. And the fourth one, which is not really common but very common in autism or autistic spectrum disorder kids or kids with developmental disorder, it's a self-enjoyment without any cause. So they like doing that, they like listening to the sound of screaming, or they like listening to the sound when the things are thrown down, and that's why they do it for their happiness. So these are usual causes of tantrum. And it's very important to know the cause of the tantrum, because that decides the treatment of the tantrum or how to reduce the tantrum. For example, the behavior is whining or crying, and what he wants is the chocolate. If you give the chocolate that time, that gets reinforced, and next time again he will do. So here the problem behavior has to be reduced by not giving the chocolate that time, ignoring him for some time, giving him chocolate for something which is not crying. So okay, if you talk and tell me you want a chocolate, I will give you the chocolate. If you cry, I won't give. Suppose the child says, okay, give me, and you give the chocolate, definitely he will understand that there is another way to get the chocolate, that is give me, rather than crying or whining. Similarly, if the child wants to escape from a difficult task, suppose he is asked to do some math problem and he doesn't like it, he is not interested in maths, and he starts asking for that, I want to go to the washroom, or I want to play, or he throws up the books. If you say, okay, you take a time out and then we'll do it again, that means he is escaping from the task and he is getting reinforced. What we have to do is tell him that, okay, we'll do just part of it and then we will do something else. So if he does that, immediately you go for something else, but he doesn't get the thing or doesn't get escape from the thing just by crying or whining or by doing some other problem behavior. So these are the ways how you reduce a problem behavior with time. If you don't know the cause of the problem behavior, you will keep reinforcing the problem behavior, which will make it more strong, and time will come when the child will start just with whining or crying, and later it will go to hitting others and hitting self. So this knowing the actual cause of the behavior and then dealing with the consequence makes it better and reduces the problem behavior with time. I hope this will help the parents as well as the therapists to understand the problem behavior and treat it accordingly. Thank you.